Well, happy, beautiful, amazing day. Dr. Bob Rakowski here with this edition of the Dr. Bob Rakowski Podcast. We have Dr. Jennifer Nelson, who's a licensed chiropractor in La Mesa, California. She was an incredible athlete, multi-sport, in fact, as diverse as I've ever seen. You ran track, the 100 and the 400. By the way, my Olympic coaches says we got 100, 200 athletes, 200, 400 athletes, but there's not typically a 100, 400. You were a swimmer. You were a diver. You were a 5'8" gymnast. I don't know how you do that because let's put it this way. If you're going to move your body, having an extra body, that makes it harder to move, but you did it. You paid a little price, but it ultimately led to where you are today. So let's talk about that path, all this diverse sports, these injuries, the care that you sought, and how did you get to where you are today?
Yeah. Hi. Nice to meet you. I have been an athlete my entire life. My first injury, I was 8 years old. I snapped both radius and ulna. And then from there, I had quite a diverse injury career in my sporting career. So I played soccer and gymnastics from the ages of 2 and 5 all the way until I was 22. I swam in the off season of gymnastics to deload my joints. And then in high school, they had a diving team and it looked fun and I knew how to flip. So they brought me on. And track because I could sprint. It was kind of just, it looked like fun. So I gave it a shot. My career ending injury in gymnastics was actually a spinal fracture, which led to a grade 2 spondy. And we didn't even find the grade 2 spondy until I was in chiro school. So that was really interesting to learn that. But my career path to chiropractic was actually through physical therapy. I knew that I really wanted to help people. I had a knee surgery at 14 and PT released me at 12 visits. And at that point, I was nationally competitive in gymnastics. I had severe atrophy and only 50% return of range of motion. And they said, go back and do what you do. And I said, I'm not sure you understand that we dismount from like 8 feet off the ground, flip 2 times, and then I have to land without hurting myself. So I was lucky to have a coach at the time who had also a meniscus tear. And so we were both rehabbing it together. And I was very blessed to have that opportunity. But I didn't really have any specialized care. So I really sought it out. And then I got to work at a local physical therapy clinic as an intern that treated professional athletes. So we worked with the Chargers, the Padres, and some other off-season teams. Some guys from the Buccaneers would come into town. And alongside of them, I got to still practice my knee rehab. So I got a little bit more knee rehab, and that was 2 more surgeries after that. We worked alongside a chiropractor. She is now in Florida. And when I was applying to PT school, she said, apply chiropractic school. It's a great career field, and you kind of get to do PT and some other stuff too. So I went ahead, applied to Palmer West. That was it. And I got in, and I traversed the chiropractic field, having never been adjusted by a chiropractor, having never seen a chiropractor in my athletic career. And I'm glad I did. It opened a lot of doors for me to do what I do now, get education in a lot of different fields and specialize in what I like to work on, which is biomechanics.
I want to take a lot of spins on that. So you broke both the radius and ulna at age 8. By the way, my daughter did that at age 10.
Yeah.
Now, interestingly enough, I knew back then if we did comprehensive bone meal, bone is not just calcium. There's 200 proteins in bone. There's over a dozen minerals in bone. The body acid alkaline balance has to be right. My daughter had complete healing of the radius at 10 days, which is amazing when you're 10 years old, right? We actually went to go swim with dolphins afterwards. And about 25% is the amount of time that we can accelerate fracture healing. That's well documented with the right bone meal supplementation.
Yeah.
Item number 2, you talked about, age 14 and having so many different things going on, so many different sports. What we know now is that the earlier that kids are involved in more sports, the more diversely developed their nervous system is, and the better all around athlete they are, and the better all around they are young, the better the elite they are when they specialize.
Mm.
And then finally, you were hanging around where the elites were hanging out. You like PT, but you made a shift to chiropractic. So what did you see different about chiropractic from PT? Because they're both valuable. There's no doubt about that. I love PT. I love chiropractic. So what did you see? Where did chiropractic give you the edge?
I really like nutrition. I really think that, we'll call it functional medicine, is a superpower for us in terms of healing the body. Um, I also felt like there was a ceiling on physical therapy. Like you hit either it was insurance who locked out that ceiling or it was the orthopedic surgeon who told you what the plan was. There wasn't a lot of diversity. And I'm not so much a rebel in myself, but I really like the opportunity at this point to do what I want to do. So depending on what the goal of the athlete is, and like we had discussed, I work with tactical. Um, they don't really need to start at dead bug and things like that. Like we need to get the rucksack on their back. We need to check how they hold their rifles. We need to get really mechanical with them and very quickly. So I had a lot more diversity opportunity in chiropractic than I felt like I had in physical therapy. And I applied in 2012. So this is over 10 years.
Let's expand on that a little bit. So PTs, they do follow a protocol. They are directed typically by an orthopedist. And like you said, they tend to be limited by an insurance plan. Hey, you may get 12 weeks of PT
Right.
and hey, you might need 52 weeks of PT.
Yeah.
And chiropractic along the way, I know the two are very, very synergistic from my own experience and from treating patients as well. So what do people do? Let's say their doctor says, "Okay, you only get 12 visits, 14 visits." How do you encourage them to be proactive and get them to buy into their health? Because here's what we know, when people pay, they pay attention.
Value, yeah. In our office specifically, we throw a lot at them all at one time. So we really map out a plan that's very holistic. We wanna look at everything, and we very much believe in a triage model. So if I know that you're seeing a psychologist, if I know that you're seeing a physical therapist, a massage therapist, an acupuncturist, I'm on the phone with those doctors with their permission to make sure that we're all talking about the same thing. A lot of doctors are surprised by that model. And it's not that I want to control the narrative, it's that I want to make sure that my patient isn't coming in. For instance, okay, patient will see an orthopedic for osteochondritis dissecans in the knee, and they'll be like, my doctor told me not to squat. And I'll be like, oh, like, how do you sit down on the toilet? You got to squat. Like, I got to teach you how to do it under the right conditions and with the right
So
training.
let's do that for a moment. So
Yeah.
how are you going to have that person squat with that knee injury? Is it gonna be a wall squat? Is it gonna be using something to assist them in the down position, up position,
Yeah,
all
the
the above?
rehab all of it. The rehab starts really basic for us, so we understand the biomechanics of at the knee, like, the knee needs to track correctly, which requires tibial internal rotation. It requires the foot to be stable, it requires the hip to be mobile in order to make that triple flexion pattern happen. On top of that, from that point, I wanna see how they balance. If they're falling out of their squat, balance may be an issue. I wanna see how they're loading weight into their toes. A lot of people who squat, somewhere they learned, "Don't put weight in my toes," so they've got everything back in their heels. And so I wanna look at their loading patterns. And then I also wanna check on their nutrition. Are they super inflamed? Because if they are, it doesn't matter how well we teach them mechanically, they're still gonna struggle with that inflammation. Eventually, we look at, arthritic behaviors and such. Um and then at home, we have them doing a lot of mobility. And again, it depends on how they present, but we have them doing a lot of mobility around the hip and the ankle and the tibia. We have them doing a lot of watching the knee track properly, patellar mobilizations by themselves, a lot of massage, infrared light, trying to get those the metabolism around the knee to start working better. So again, we throw the kitchen sink at them. We map it out very nicely, but we do throw the kitchen sink out of them with reminders constantly of these ancillary processes.
As do I. So there's probably gonna be some practitioners listening to this. I remember one time, asking myself the question in clinical practice, what's the one thing I could do for the patient that would get us the biggest return on investment? Well, that seems like a good question, but I realized I was actually asking, what's the least I can do to get the most? I changed the question to what's the most I can do to get the most? And what you've done is you've only said, not only do I recognize that there's a lot of components to it, but it often needs a team, and that's what I found the best of the best. So you mentioned psychologists, you mentioned massage therapists, you mentioned acupuncturists, you mentioned chiropractic, biomechanics, nutrition. So we've got mental, we've got physical, we've got energetic, we've got emotional. Which of those do you think is the most dominant player in most of the people out there that you're seeing? Let's go
Oh
with your.
gosh. Okay. So my patient population is veterans and law enforcement. That I would say that's about 90% of our patient base right now. My second business is specifically law enforcement. So I've spent a lot of time with these guys and women, but mostly men. Um, I'm gonna say dominantly, it's gonna be the mental stuff. Predominantly in this patient base, it's gonna be the mental stuff, and we're talking multifaceted. So we're talking PTSD, very poor gut microbiome, lending to more PTSD type symptoms. We're talking pain avoidance and fear avoidance behaviors. We're talking they are trained to just tolerate. And having been a gymnast and had a period of life where I was addicted to Advil because I just had to show up, I get it. Like you got to just show up and do the job, whether your body hurts or not. Um, so it is a lot of the mental training of like, we need to teach you not to be afraid of your body. We also need to teach you how to support the system so that the temple can support the job that you need to do. And we need to do it all under the umbrella of maintaining this sort of allowing that masculinity to be the prominent like mindset that they have, but also telling them like you got to take care of that. Like you could get out there and do it, and then the stats are not good on law enforcement. 55 years old, you're looking at high rates of heart attack, diabetes. You're looking at joint denigration that's happening super super early. So if we can teach them to take care of the system and tell them that's going to prolong their life in this like dominant state of mind, we tend to be able to get far with them. The ones who really just want to like power through it, those they take a little bit more work.
Well, these guys that push and push and push and push and push, they get a lot done, but they pay a much bigger price. And wouldn't it be nice if we could teach them, literally there's a season to push, there's a season to recover.
Yeah.
But even in our daily rhythm, if you're going to push hard, then you need to recover extra hard. Do you have any mental tips? Have you had any of your law enforcement people with PTSD try psilocybin or any of the things that are cutting edge with that, or red light therapy or methylene blue or, all the above?
Yeah, I'm not specialized particularly in, the psilocybin or the MDMA. I do have some colleagues that are really, really they study that, so it depends on their knowledge and their help with that. I have had people ask. I am a fan. I don't do it myself, but I am a fan for the PTSD and to kind of break that barrier that they're coming across. Um, Methylene blue, we are starting to discover in this office and use it more frequently. I was waiting for the company that I really, really like to test it against their drug test to make sure that we don't have any issues. Red light, I'm a huge infrared light proponent. I have almost everybody purchase a red light that's in my office. I have found so many benefits for their sleep, for their circulation, for their pain, for increasing metabolism to help them heal faster. I also am a big proponent of sensory deprivation, so I will recommend my patients to go do float tanks. We found a lot of benefit with float tanks for both mental and physical. Um, and what else? We'll even prompt them to do some writing exercises to have them, you know, we'll offer them a prompt, and sometimes it's like take everything you can't control, write it down, write F it at the bottom, crunch it up and throw it in a bucket and then light that thing on fire. Like it's aggressive, but this is the stuff that's in their head that's also placating into their bodies. And if I can help them get it out, um, we tend to make a lot more progress if we could just like get that stuff out of your head.
I agree. And, Yogi Berra once said baseball is 90% mental, the other half is physical. And my elites, I don't care if we're talking about elite special forces, elite athletes, elite people in business, they're going to tell you it's 90% mental. I'm going to throw in my best biohack right now.
My
Reishi
favorite.
infused coffee, the world's number one healthiest organic coffee. It's great for the brain. It's great for the body. It's great for the spirit. It actually is shown to reduce the amount of circulating stress hormones, become anti-inflammatory, alkalizing. bettercoffeeshop.com. Try your one box challenge today. Now, you also mentioned the gut brain connection as it ties into PTSD. So, what strategies do you have there? Do you find that there are certain foods that maybe are almost universally needed to be avoided in people with PTSD? Let's start there.
Um, I don't know if I would sit on that so much. I think that we have a specialist in our office. She's not a naturopathic doctor, but she is a blood lab counselor, and we run labs in our office because we started seeing some really big trends. So low testosterone, either very high or very low cortisol. We started seeing a lot of liver blockages happening, and obviously we know that's where the hormones are processed. So, and a lot of my law enforcement that is coming in here, they're not necessarily dealing with so much gut health symptoms that they can feel, but out in the field in general, you start seeing the bellies happen. And in my head, besides the aesthetics, you're looking at the fact that, there's a lot of inflammation in that gut. And those guys tend to be a little bit more frustrated, just kind of so just frustrated and angry. And it was an interesting correlation. So in terms of gut health, I don't tell people to stop eating certain things. I do prompt them to cut down on their alcohol. I think that's a big starting place because it is a vice. Um, I do ask them to clean it up a little bit. So just just clean it up. Look at your plate, protein, vegetables, and some complex carbs, and just make it really simple for them because I think there's a lot of information out on the internet right now, and it could get very confusing and overwhelming. So the simpler, the better. You should, first thing in the morning, 30 grams of protein minimum. Your lunch should have 30 grams of protein minimum with some vegetables and complex carb. Your dinner should look very much the same. If you need a glass of wine or a beer, do it before 3 o'clock in the afternoon and don't do it on a work day. Um, and sugar, just do your very best to cut out the extra sugar. And the energy drinks are a big problem, obviously, we know. So I do prompt them with the King coffees. It's one of my favorites. And then we go down the rabbit hole of mold in your coffee. So I'm like, stop going to the chain coffee places. Start buying your coffee specialty so that you can make sure you're getting quality. If you're going to spend the money, you might as well get it quality. But yeah, I don't tell them to stop eating gluten and stop eating dairy. Some people do okay with dairy, but we test it, right? We test it because if I'm a doctor and I'm offering blanket statements, I'm no better than the multi-level marketing company that's trying to sell you supplements. So I need to be a doctor. So I test it. I want to know, how does your body deal with these specific inflammatory factors, and is there a way that we can help you mitigate it?
Well, I love that. One of the early phrases that I really enjoyed from a mentor was prescription without diagnosis is malpractice.
Yeah.
So you're figuring out what the patient needs. By the way, my dietary recommendations very much like yours. Jack LaLanne said, if God made it, it's okay. If man made it, stay away.
I love that.
Right? That simplifies it. And then if I were going to complicate it, which I'm good at complicating, right? Eat real food, clean food, not too much, not too often, every color, every day in a way that honors your physiology, your genetics, and your body goals, mostly plants. People can get to that, but we start with cleaning up, right? That is really, really good advice. So we got the mental, we got the gut. Let's deal with this physical pain. And by the way, you're finding we had a conversation beforehand. You said sometimes their structure looks good, sometimes their MRI, their scans, they look good, but yet they're reporting pain. And there's more to it than that. But we still need to balance the structure. Yes.
Yes, always, always. And that's what we're specialists at, right? Is balancing the structure, making sure the anatomy is fitting like a puzzle piece together and articulating the way that it needs to articulate and finding those places that are sticky and unsticking them. Which is why we like the adjustment. We think the adjustment is an extremely important tool. However, I have an ACL in here. I don't need to be popping around the adjustment. I need to focus on his anatomy, her anatomy, what's happening with that ACL. But structurally, we film all of our patients. We slow-mo everything so that they can see what we're talking about.
Video fluoroscopy, or what do you do?
No, just what's my iPhone? Just my iPhone and just slow-mo it. Yeah, nothing real fancy. Um, we do fancy together as a cohort, but to the patient, they can't see half the stuff I'm talking about. They just agree with me because, they're trusting me. Um, hmm. And then we will have our guys our tactical guys, we'll have them in their gear, and then we'll look at how they're moving, and then we'll take the gear off and see if they're moving the same. And that's obviously a huge discrepancy, is because if you're walking in PT clothes like you're holding a sidearm, you have a whole issue of anti-rotation that's going on, that's going to be structurally unsound for the tissue, the fascia, the muscle, the ligaments, everything. Um, and then we break it down. We set a goal. What's the biggest bang for our buck, right? So sometimes they come in with a knee, but it's not the knee, it's the hip. However, the knee is the thing that has the pain. So we have great pain mitigation tools, that infrared light, your rock tape, your instrument assisted soft tissue, that kind of stuff. But we're going to gear our mechanics at the hip and the ankle to support the knee. So our treatment plan is very, very much looking at the chain and how the chain is interacting with gravity, and how the chain is also interacting with your external stimuli, which is all this gear that these guys carry.
So one, I love your approach. Two, just everybody out there as a patient, think about that. If you have a knee injury and you're not resolving it with regular easy therapies that should, it's not the knee.
Yeah.
So look to the ankle, look to the hip, look to the lumbar spine. And then we're complex beings. The analogous joint to the knee is the opposite elbow. The analogous joint to the hip is the opposite shoulder. The analogous joint to the ankle is the opposite wrist. And believe it or not, chronic dysfunction in an analogous joint, yes, my right elbow could cause a left knee problem or vice versa. So you want someone that understands the workings of everything. So you also mentioned energy. You mentioned acupuncture. So do you work specifically with acupuncturists? You know what they're attempting to do when they're working with these patients? Is it like acute management, local acupuncture, whole body energy balancing, a mix of all the above?
Yeah, I have a couple of acupuncturists that I refer to specifically. One is a sports acupuncturist, so he does a lot of movement, tissue movement, fascial stuff. Um, I also have an acupuncturist I refer to that does more energy, and it's just really patient dependent. It depends on what the patient really needs. I think everybody needs energy work, really, in this world. I think we're all, containers ready to implode. But I do have two specific acupuncturists that I refer to, just depending on what. And of course, this is a bias, right? This is what I think the patient needs. And sometimes the patient doesn't need that. And the blessing of the acupuncturist is that a lot of them know both sides. They know the energy meridian side, and they also know the physiology side. And so I can appreciate the specialty there.
And, for people that haven't studied acupuncture, meridian therapy, it's one of the oldest health systems. And in ancient China, the only way the barefoot doctor got paid, that was the name of the acupuncturist, was if the patient didn't get sick. So they constantly want to balance the energy of the body. I was once asked to explain acupuncture, and very, very simply, we know there's energy that flows through specific channels of the body. You could think of nerve, you could think of blood, those have defined channels. Energy channels, they're more adaptable, but there's points along the channel where you can add, subtract energy, or move energy from one to the other. Balanced energy is health. Energy out of balance is less than health. I think it's one of the most comprehensive systems that are out there. So you have an area where there are a lot of law enforcement and a lot of military. So what are the specific challenges that you're seeing, and what do you see as a comprehensive protocol really helping with? We already mentioned the PTSD, but are you seeing things like diabetes, hypertension, cardiovascular risk, body composition challenges, maybe all the above?
Yeah, physically, we're seeing a lot of low back and knee is pretty popular. Um, a lot of these tactical units, they do Brazilian Jiu-Jitsu as part of their training. Their DTAC training looks a lot like wrestling and Brazilian Jiu-Jitsu, so there is that extra impact on the body. Um, and not all of them have PTSD. Oh, quite a few of them do. Um, a lot of them are really good at containing what they're experiencing. Um, but what we started seeing in the office a few years ago was a series of, I'm not even gonna call it a mental breakdown, but anxiety seemed to be a high complaint. And as we dove further in, we started seeing the relationship between law enforcement and veterans specifically. Anybody who's worked a night shift, the men were having really, really, really low testosterone. And we were getting them tested, and their primary care physicians, and this isn't a knock on primary care, but they were coming back in the 300s and 400s at very young ages, and the doctors were saying they were normal. And I said, "Do you feel normal?" That was it.
Well, normal is sick in this population.
Really,
Right? No.
it is. And the use of energy drinks and we were seeing these common behaviors, and I thought we got to dive deeper into this. So then it was low testosterone and either very high cortisol or very low cortisol. There wasn't really that really nice rhythm that we are supposed to have. Um, about 10 years in, kind of there's this bracket of maturity where we were starting to see body composition changes, so that the bellies were getting big. Um, Poor diet, a lot of stress, a lot of poor stress mitigation, and a lot of night shift, a lot of really poor sleeping habits. So they're having trouble falling asleep. They're exhausted in the morning, and then they're just driving all day. So physically, we're seeing a lot of low back. That's very, very common. Um, Palpation wise, as a chiropractor, the rib cages are very robust in our veterans and our law enforcement because of the vest that they're wearing. So the intercostals are really tight. The diaphragms move very poorly. And so all of those accessory breathing muscles are really, really hypertonic and really enhanced. And just teaching somebody belly breathing who wears a vest is like a whole new eye-opening experience for them. But internally, we were seeing those in the labs, and then a lot of addictive behavior, right? So they're addicted to, they need the energy drink. They need the 14 cups of coffee. They need that 3 o'clock, boom, that dive that was happening. They're pumping themselves full of sugar just to get through the day. And so we were seeing those behavioral things, and that all in complexity can create a very chronically painful body, a lot of tension everywhere. And to your point, they would come in and they're like, my hips are tight. And I'm like, your hips aren't tight. Like mobility wise, your hips are moving great. I'm like, this is a systemic thing. This is the body trying to survive, and it's pulling you inward. And we have to put it in a parasympathetic place. A lot of breathing, a lot of sound waves, a lot of heat and vibration distraction to try to open up the system a little bit. And then we load it when it's open to try to teach the brain that that's a safe place to be. And just that fluidity in and of itself, it makes a big difference for these guys, because otherwise they're here, right? Like all the time they're here, and they're in their vest and they're in their vehicle and they're like this all the time. So
Well, you said so many things are important, and one, I hope the whole world recognizes that we should take really good care of those who take care of us, and these law enforcement, military people, and special ops are keeping us safe. Number 2, when they're wearing that vest, they are restricting their breathing. There's a physiologic parameter known as vital capacity. And literally, it's related to how long you're going to live, and it's related to how deep a breath you can take. So if you're weighed down and constricted and compressed and not breathing for most of your workday and sitting and not moving, and then being stressed and not nourishing, it's a perfect storm for early death. And those that take care of us don't deserve early death. They deserve great life. You also mentioned 14 cups of coffee a day. Yeah, I'm seeing police officers. I think the most I'd ever seen claim to have drank 8 pots of coffee a day,
yeah, we're
right? That's the most I had seen. And reality is every cup matters. Herbicides, insecticides, fungicides, molds, mycotoxins. Another plug, bettercoffeeshop.com. You do so much, and you actually have some type of camp or boot camp or retreat, or what do you have? What did I read in there that I'm looking for?
that's old. Yeah, so that's my second business. So the clinically we have a high law enforcement veteran population. I personally have a second team of practitioners where we go in and do training days for federal and local law enforcement on their topic is resiliency, but we have taken everything we've learned from our patients and made an 8-hour training day, and we break all of these things down. We go through functional optimal lab values and tell them what to look for. We teach them different ways to breathe. So these guys need to be able to turn it off and turn it on. So I want them to be able to use their breath to amp the system up, and then immediately to teach themselves to calm down. So you have that nice sympathetic to parasympathetic wave. We do mobility. We do proper technique. Like these guys are in the gym throwing weight around, and their hip hinge looks terrible, and it's because they have back pain and they're in gear. So it makes them move very funny to avoid the gear. So we get in, we teach them how to do a hip hinge again. We teach them how to do a proper plank hold so that they can hold their core steady, so they can be more agile, put force through different areas. I can't even think of all the topics. We basically broke down 13 topics into coursework. And then we would love to run some retreats for our law enforcement families so the husbands and wives can spend a little bit of time together doing this stuff together. So as a family unit, we can take care of the wives and the husbands and make sure that they're partnering up in the course and the journey for longevity. Because as we talked about, the stats are not good after 55. These guys retire earlier than any other career in the world, and their longevity is very short, and heart attack and cardiovascular disease are very high risk for them. So we love to give them these tools and then help their spouses and their partners do it along with them so that they've got their own team at home to live their long, early retired life. I don't want to see them. I don't want them in here every day. Like, I want you to live.
Good for you. I love that. I've done a number of Zooms for different groups that specialize in PTSD.
Yeah.
And I hate to say that at least half of those groups just seem to, I don't want to say wallow in each other's misery, but they just keep reliving the trauma, which maybe is part of the recovery. Then there's other groups that say, let's get past this. Here's how. It's a comprehensive approach. Sometimes psilocybin, always nutrition, always counseling, always movement, always finding ways to get a break from the stress. Dr. Jennifer, you are a gift to our world. What is the best way for people to get a hold of you?
Oh, I'm easy. You can find me on Instagram at Maverick Chiro Clinic or at Dr. Jen DC. You can call the office, maverickchiropracticclinic.com. Email. I'm very easy to get a hold of because I want to be accessible to those who are serving me and protecting me and having family who are in law enforcement. It's important that, they know they've got somebody on their team. So any mode of social media or email is easy to access.
Well, we reap what we sow. I trust you and your family are going to be beautifully protected and blessed with vibrant health because you're helping so many others. And as always, I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful. Thank you so much, Dr. Jennifer.
Thank you.